Hi, and welcome to Open, the show that opens the Bronx and the rest of the world to you. I'm Kibin, and today we'll update you on what's happening in and around our borough. Coming up, St. Barnabas Hospital Health System is on a mission to support the healthcare needs for the people of the Bronx. The Senior Executive Vice President and the Chief Operating Officer for SBH Health System joins me to discuss their expansion plans. What are the plans to modernize SBH Health System? Then the climate crisis is causing heat waves that are more frequent, more intense, and lasting longer. The Resiliency Coordinator for We Act for Environmental Justice shares more on their efforts to help combat this issue. How are these heat waves affecting New York City? After that, NYC is home to the world's first psychedelic social club. The founder and the CEO for the Psychedelic Assembly tells us about the journey to creating this club. What is a psychedelic assembly? And finally, emotional intelligence is an increasingly desirable trait in the workplace, which makes SEL curriculum significantly important for students. The Senior Director of Social Emotional Learning at the Urban Assembly shares more on his mission to add this curriculum to more schools. What is the SEL curriculum? So stay tuned, all this and much more is headed your way because we're now officially open. Hello, everyone. I'm Kibin, and today is Tuesday, September 5th. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. In an effort to support healthcare in the Bronx, St. Barnabas Hospital Health System plans a renovation project for its Bronx location. The project will focus on the expansion and modernization of the SBH Emergency Department to address health disparities and improve patient care and experience. The Senior Executive Vice President and Chief Operating Officer for SBH Health System, Dr. Eric Appelbaum, joined me to discuss these plans. Doctor, thank you so much for joining me.
Thanks for having me.
So can you just tell me about the SBH's latest renovation project?
Sure. We are in the design phase of an emergency department expansion. Our emergency department last expansion was about 20 years ago when I was a junior attending there in the ER. I'm an ER attending by practice, and we've sort of outgrown our space. We probably outgrew our space a long time ago. And the needs for this community are just ever increasing, and we really need to modernize so we can give our staff and our patients a better experience.
No, I think it's just so interesting, especially for me, just as somebody like on the outside looking. I don't think that we often think about like the planning that goes into a hospital and, how we can make sure that patients and people visiting there can kind of nobody wants to go to the hospital, right? But
Right.
You want to make sure that while you're there, that it's an experience that you don't think negatively about. So,
Absolutely. So, we're looking to address all those needs, right? A hospital, to me, it's like a little city, right? We have to feed people. We have to take care of them. We have to keep them safe. But, while you're there, as a parent, I've been in emergency departments in several places, and you want a really nice experience. You want to have a dignified experience. You want it to be private. Right now, the way our emergency department is set up, it looks more like an open, sort of like a MASH unit. And while the care is great, while my nurses are fantastic and the ancillary staff and the physicians are amazing, it's not a dignified experience at all times. And that's what we're looking to do. You bring your loved ones in, and there are private moments. We have behavioral health challenges, substance abuse challenges. You don't need that advertised to the public, and the public can be right there. So we're really looking to improve that experience so that people want to access healthcare, right? Especially for our young folks. We don't want them to be afraid of physicians. We don't want them to, the physician, from the beginning of time should be a long time sort of trusted, or the healthcare system should be a trusted area and something that you want to go to. So we got to do our part, especially for the emergency department.
So I kind of want to expand on that. So is the mission to kind of make sure that the emergency department is possibly more private? Is that what you're?
That's definitely one of the a huge point. Absolute private rooms. Like I said, when I've gone to emergency departments, there are TVs in every room, and we're going to do our best to make it as fancy as possible. Why not? Why not make it fancy? And more private, so that when I'm having a behavioral health discussion with a 17-year-old, young child about depression or anxiety or about bullying, it's not out in the open, or someone's having one of the worst days of their life and I have someone who's intoxicated or someone who has a trauma and is grieving. It doesn't have to be, there's ways to make it better. There's ways for people to look back on that moment and say, hey, there was some dignity there. So that's a key, component of what we're trying to change.
And I could also imagine that it's really important because sometimes that experience makes people not want to go to the hospital because, like, maybe you don't want everybody to know what you're dealing with or, possible judgment. So I'm really glad that, healthcare professionals are actually thinking about that experience. Now, I also want to talk about that experience and how it's specific to the Bronx, not as specific to the Bronx, but, how it affects people from the Bronx. Can you just talk about some of the disparities, Bronx residents face, when they encounter any emergency room or the hospital in general?
Sure. Well, a lot of our patients are under or non-insured. We have obviously a large migrant population with no insurance. And, the access that they have to primary care is just less. It's just not as good. The hours aren't the same. The ability to connect to physicians is not the same. So they end up choosing the ER as a last resort, right? There's urgent centers that have certainly helped a little bit in some cases, but our folks have to come here out of, almost for things that you and I may not have to go to an emergency department for in the middle of the night. When I was a resident, I used to see young moms bringing 3 kids in the middle of the night. I said, this isn't fair. Why is she doing that? That might be her only choice because she's got to get up and go to work tomorrow and her doctor's not available because there just aren't doctors available. So the disparities of just the access are huge. And then the experience is different. I'm sorry, but when you go into some of the, areas across the country where the resources are just much more intense, it's just nicer. It just feels better. Like I said, the care is fantastic. We're doing the right thing. Our doctors and nurses know what to do, but it's just that feeling that you get of, that there's someone there for you and can dedicate their time and it's not chaotic. So,
and I'm also glad that you're really here because this is a question that I've asked myself multiple times as somebody who just is from the Bronx and, maybe I'll go to a healthcare provider. Are the wait times also the same? Because I noticed, at least for in my community, sometimes if you go to the ER, you're waiting 8 hours, 9 hours.
Yeah.
Is that a thing for everybody, or is that specific to areas like the Bronx?
It's going to be higher in low resource areas, right? I mean, we're also going to address things in our community that aren't addressed everywhere. We obviously have a high behavioral health population. Some of those patients may need more resources. We have a trauma center. We're a level 2 trauma center. We're very proud of that, and in some of the areas, and especially in different cities, it's not as high a need. And so when you're essentially in triage, with your cold or flu or whatever we're addressing, or a heart attack, obviously we take right in. But with some of the minor complaints, if a double shooting comes in, and I hate to say that, that does happen, it's going to slow things down. So the wait times, it's a direct result of resources often. And that's something that we're looking, by making the flow of the department and the physical structure enhanced, will improve that. There's no doubt about that. The way we triage people, the way people access the physical department is just going to make things go easier and will improve those times.
Now, how do these obstacles create challenges for healthcare professionals and how they connect with their patients?
That's a fantastic question. So, every year we get young residents and, new physicians into the system who are training, and nurses. And that's the first thing that they look around and said, how can I have this conversation? How can I connect to this patient if there's 4 patients right next to me? I'm whispering, and I used to do the chart whisper. Now it's all electronic, but I used to sort of cover the chart and hide and say, hey, tell me about this sort of your XYZ problem. And I'm embarrassed, you're embarrassed. And it's not that I'm embarrassed about the topic. I feel bad. I'm saying this right next to someone. So the connection just isn't there. We see the connection in primary care, right? I also did primary care for many, many years. And the connection I had with those patients, their family after all these years, you're in the room, and you just get that one-on-one, the eye contact. One of the things that we always teach our physicians is, when you have the opportunity with a patient and you can sit down. You shouldn't be standing, leaning over the bed. Sit down. You're talking. It's person to person, right? They're not patients all the time, right? They're people all the time, actually. So that's something that the staff are really, really excited about, making it a much more, conducive environment for the connection.
And also, I guess to expand on that, how could, a lot of these upgrades, we talked about a few of them, how can this strengthen that relationship, especially in a community where there's a lot of distrust already?
Yeah. So it just gives you more time. It gives you more privacy to get to the third, fourth, fifth question, right? Remember, as an emergency department, as any healthcare professional in anywhere, it's not only your responsibility to just address what the emergency is, right? Especially if someone comes in with a sprained ankle and I notice your blood pressure is a little high. I'm going to tell you right now that me taking the extra 5 minutes in a nice quiet environment to talk to you about the dangers of high blood pressure and why you should take your medicine, probably more important than addressing that ankle. And that connection there will lead to better health for that patient and hopefully their family down the road. So yes, that definitely is important.
Now, according to an interview with SBH Physician Magazine, you've been with SBH for over 20 years, which I would say congratulations.
Thank
That's
you.
like a really huge accomplishment. How have you seen the world of healthcare transform, especially in communities like the Bronx?
Well, this is my 26th year at SBH, so sort of born and raised there. I'm not born technically. I was born at Einstein in the Bronx. Spent some time here with my grandparents for many years. I think now we're really starting to address sort of vigorously the social determinants of health. And this is something that was not when I was, a resident and a young physician. We are talking about homelessness. We're talking about the poverty. We're talking about hunger. I mean, we supply food to our patients now. We run a food pantry. We have a teaching kitchen to teach people how to cook culturally appropriate and eat healthy food. We have a gym so people can work out. We have a farm where we're teaching people about how vegetables and healthy plant-based meals may improve their health, will improve their health. So I think that's the big key, is to really focus on the people. And the social determinants are everything now. It's tragic, but because I'm sorry if you live in New York City in certain zip codes and then you just take a train ride up, your life expectancy goes down just based on where you are. And that's something that in today's day and age just shouldn't exist. And it does, and we're doing our part to face it.
Now, I guess for the overview, can you just explain, what the expansion plan is? We talked a little bit about that, but can you just give us like an overview of like what the plan is?
Sure. So the plan is to completely modernize the ED. So we plan to add tons of private rooms, improve the access for the ambulances, a dedicated behavioral health unit that's, a dedicated pediatric unit, geriatric unit, upgrade a lot of the staff workstations. So there's a whole suite of options that we have there, but we're really looking to address what the Bronx needs, right? So I want to improve my trauma access. I want to improve behavioral health. I want to improve the experience for substance abuse patients, and then pediatrics. Definitely, when kids have to come to the ED, we need to have a dedicated space. And unfortunately, over the years, we've had time where we sort of had to just move people around. And that's just, it's not good for the staff. It's not good for the patients. So we're really looking to improve all that with this project. And it's very exciting.
And I'm excited just hearing about it, because I think that it's important for people to understand that like these things are being looked at. Like I said, sometimes I'll go and I'll be like, this should really be fixed. Like thing shouldn't be this way. So it's so glad to hear that, that your team is actually thinking about that and working on it. So I appreciate, you taking the time to talk to us about this.
Thank you so much. Well, we're looking for support, obviously from our community, our elected officials, and, we hope we can get this done. And, I appreciate the time to talk today. Thank you so much.
Thank you. If you want to stay up to date about SBH's plans to expand their space, please go to their website at www.sbhny.org or follow them on social media at SBH Bronx. Stick around. We'll be back with more Open right after this.
Kids! I don't want to talk about it.
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 Families don't have to talk about everything, but they should talk about how to plan for an emergency.
Kids, you all right?
This family's prepared. Get tips and resources to make your family's emergency plan. Go to nyc.gov/readyny or call 311 for more information.
Dear moms and dads, what you have achieved here today is going to help us and our futures. It is why we are coming up on stage to collect your diplomas.
You know it's true.
Mom, love you always.
Everything I do,
When you graduate, they graduate. Visit finishyourdiploma.org to find free and supportive adult education centers near you.
¿Qué color? Perfecto, mijo. Gracias. Thank you. What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Welcome back. Extreme heat waves in NYC are increasingly becoming more prevalent because of the climate crisis. These heat waves are a growing concern for environmental justice organizations like We Act. In an effort to address this issue, We Act joined forces with several organizations to form the Extreme Heat Coalition. Joining me to discuss this topic is the Resiliency Coordinator for We Act, Caleb Smith. Caleb, thank you so much for joining me.
Thank you for having me.
Now, can you just tell us a little bit more about your organization, We Act?
Yes. So We Act was founded in 1988 in Harlem. We, at our core, are focused on making sure that people of color and low-income communities are included in the sound and just creation of environmental policy. And that's increasingly including more work on climate justice. I'm really focused particularly on extreme heat. And one major initiative that we've launched earlier this year is launching the Extreme Heat Coalition. We have about 7 members based between New York City and Yonkers, and we bring a diverse range of areas of expertise and work focused on uplifting health equity for vulnerable residents in urban areas. And so we're in the process of expanding to other major metropolitan areas throughout New York State.
So I wanted to actually ask you a little bit more about the Extreme Heat Coalition. As I mentioned, it was like kind of like a collaboration between a lot of different organizations. You know, can you just tell me a little bit more about how that actually began and what the specific purpose of the Extreme Heat Coalition is?
Yes. So the Extreme Heat Coalition is part of our Heat, Health, and Equity initiative, and that started, I believe, in 2019. We are focused on making sure that residents that are particularly vulnerable to the urban heat island effect are protected through policy, adaptation planning, and investment in resilient infrastructure.
Now, what I really, I guess a question that's very interesting to me is basically it's very simple, but what is the climate crisis? And I'm asking this because I feel that a lot of times in conversations about the environment, sometimes people will say climate change. I know previously it was global warming, and sometimes the term is, I guess, used interchangeably. So could you just explain, like, you know, maybe why we're using the term climate crisis right now?
Yes. So I think it makes a lot of sense just by definition. A crisis refers to a time where it's very difficult and there are a lot of obstacles ahead and serious decisions need to be made to prevent dangerous consequences. And we're in that right now. Our elected officials have been putting off these critical decision points for decades. And so to talk about global warming, climate change without recognizing our role and the things that we can do to prevent catastrophic conditions for the world and for people, I think doesn't give the full picture. And so right now, people of color in the United States and across the globe are experiencing some of those effects much more severely than white and wealthy counterparts.
Okay, so pretty much it is like they're all similar, but just using crisis kind of lets people know that this is actually a problem and not something that's just naturally happening. Is that correct?
Yes.
Okay, thank you so much for clarifying that. Now, how is the climate crisis causing these heat waves?
Yes. So just to rewind a little bit, the climate crisis is driven by the burning of fossil fuels. We are forcing carbon into the atmosphere that's been buried for thousands of years. And once it's up there, it stays for hundreds of years. And that prevents a lot of the energy from the sun from going back out into space. And the consequence of that is we need to make sure, can you?
Well, yeah, basically, I just want to know like how these heat waves were, how is the climate crisis causing these heat waves?
So the climate crisis is causing these heat waves because the conditions that cause a heat wave are basically high pressure weather systems in the atmosphere. And a lot of that has to do with complex things like jet streams, which are really fast bands of wind that move high up in the atmosphere. And now we're seeing that hotter global temperatures are slowing down the jet streams. So what that does is it makes these high pressure systems that cause heat waves linger over our cities for longer. And cities especially are more vulnerable because of the urban heat island effect. That refers to the phenomenon where the high density of buildings and very little natural land cover traps a lot more heat. So that's why we're experiencing it so much more severely in places like New York City, but also the south and southwest portions of the United States really have not had the benefit of jet streams moving at the speed that they have historically.
Now, you talked about how it's affecting New York City. I'm curious, you also mentioned that a lot of your work kind of focuses on people of color or like highlights the disparities people of color face in regard to environmental injustices. Can you just talk about, how we see that play out in New York City?
Yes. So in New York City, the differences are really pronounced. Black New Yorkers experience heat-related illness and heat death at twice the rate of their white neighbors. And that's a result of historic environmental racism, things like redlining. Redlining is a policy from the 1930s Homeowners Loan Corporation, which basically blocked the flow of investment into areas where Black people and immigrants lived. And the result of that is that our built environment has a lot less shade, a lot more building materials that trap a lot of heat, poorly maintained apartments that have a lot of leaks in them, issues with pests and other things that make it really difficult to cool them down.
And I also want to add that we recently did a segment about like mold, which also, contributes to a lot of the poor health a lot of Black and brown people face in our city. So, I mean, seeing this add on to it is just like, it's really shocking to hear. Now, I also want to know what other communities in New York are facing health risks due to these heat waves. The first one that comes to mind is possibly elders or people with physical disabilities. Can you just talk about maybe how this could be affecting them as well?
Yes, there are a lot of groups that faced heightened risk when we're talking about extreme heat. Elders and young children especially, pregnant people, folks that are on common antidepressants all have difficulty with regulating their temperature. just that's the physiology. But there's also folks that experience asthma who are facing additional health issues because of extreme heat. It aggravates asthma and can cause more attacks, resulting in missed school or work and even hospitalizations. And especially in areas like northern Manhattan and many parts of the Bronx, we have much higher rates of asthma.
Now, I'm also sure that possibly being in a low-income family could affect this. What is the cost of living in a city facing constant heat waves?
Yeah, so the issue is that low-income households already are spending way too much of their monthly income on just their energy costs. And especially in New York, there's not a lot of infrastructure and more equitable and fair ways of pricing energy. So what that means is people are sacrificing their income to pay for their electricity bill instead of paying for things they might need, like medication or food. And it really creates stark differences in terms of how we can take care of ourselves.
Now, your organization says New York City and New York State have been slow to respond to the public health threat of extreme heat. Can you just expand on that a little bit more? And, talk about the fact that this is like a public health threat.
Yes. So some of the ways that we really want to see New York City and New York State respond to extreme heat are pretty straightforward. For example, at the city level, we have launched some digital campaigns to make sure that folks are aware of things that the city can do. One is investing in our green spaces and making sure that we're planning for them long term and making sure that those investments flow equitably. This is in the Urban Forest Master Plan, which is currently in council. Then additionally, we want to see that the city mandate an indoor maximum temperature. Folks may be aware that there is a minimum temperature that landlords are accountable to provide in their apartments during the winter, but there's no equivalent for that in the summer. So we want city council to engage with the community and think really comprehensively about how everyone's right to cooling is protected.
And I can imagine that also kind of plays into the fact that like a lot of people are spending more money because if there's no set temperature for the building, they're probably going to be using their ACs more, which is that even good for the environment to, I guess, even use the AC that often? Just a quick question.
Right. So that's really great that you brought that up. Air conditioning usage does contribute to greenhouse gas emission, but in the short term, we understand that is what people need, but that's why through mandating an indoor maximum temperature, we can chart out a path towards more sustainable cooling. And also at the state level, we have been active supporters of things like the All Electric Buildings Act and a similar city level bill, Local Law 154, that starting in 2024, buildings with 7 stories or lower will be required to have electric cooling. And with also at the state level, we're working on getting the Energy Efficiency, Equity, and Jobs Act passed, which will create jobs in mitigating health hazards and leaky walls and roofs that need to be fixed before energy efficiency and renewable energy technologies can be implemented in the buildings that need it most.
Well, Caleb, I want to thank you so much for joining us and having this important discussion.
Thank you so much. And folks who want more information about the work that we do, they can visit us at weact.org/heat. That'll have all of our digital actions available for them.
So you heard it. To learn more about We Act's effort to combat the heat issue in NYC, please go to their website, www.weact.org/heat, or follow them on social media at WeAct4EJ. Stay tuned. We have more open for you right after this.
Even though we didn't grow up together, he's my favorite brother. Hey, sis.
I'm the baby of the family, and he's the gentle giant.
What you know about Port Georgia?
Man, please, that's a classic.
You know when they say people are a rare breed? Yeah, he's that.
I'm sorry, I'll be back in a few hours.
Don't worry, Shug. You know I'm for you.
I know.
Go get the football.
That was my favorite memory. He was always for you. This is a true story of me, Bridget Floyd, and this guy, George Perry Floyd Jr., my big brother.
You're not going to get it all right. Just make sure you nail the big stuff.
Mama!
Like making sure your kids are in the right seat for their age and size. Get it right at nhtsa.gov/the-right-seat.
Welcome back. With the goal of educating people on the effects of psychedelic plants and drugs, the organization, the Psychedelic Assembly, created a space in Midtown Manhattan that serves as a center for collaboration, education, and connection related to psychedelics. Founder and CEO of Psychedelic Assembly, Kat Lakey, joins me to discuss her journey with this organization. Kat, thank you so much for joining me.
Thank you for having me.
Now, can you just let everybody know what the Psychedelic Assembly is and basically what it's all about?
Yeah, the Psychedelic Assembly is an organization designed to provide in-person connection for people who are curious about, interested in, or passionate about psychedelic substances. And we do so with our new community center in Midtown Manhattan called the Athenaeum.
Now, as founder, can you just explain what inspired the creation of this organization?
It was largely a personal desire for connection. I was new to New York, feeling kind of lonely, didn't have many friends in the area, and especially no one who was interested in talking about psychedelic substances. So that was a big part of it.
Now, I understand that you also went to Peru, which sounds really exciting. To me, it seems like stuff that you like see in movies. So I'm actually like curious to know, tell me more about that experience and how it led you to where you are now.
Sure. So from 2017 to 2020, I worked at a very small ayahuasca center in the southeastern Peruvian Amazon, studying traditional plant medicine with the Maracay people. And it completely changed my life. It showed me the power of psychedelics, working with ayahuasca. I saw a lot of people come down to the center and have very transformative experiences with it. And then ended up having to evacuate the Amazon in 2020 when the pandemic hit. And it led me by a very weird route to New York City in a weird way.
Now, I'm curious to know, like, how, just from that moment to where you are now, like, actually, like, kind of making this passion into a business and to work. Can you just talk about that experience and, what were some of the challenges that went along with that?
Yeah, so, I mean, a big takeaway for me from working in the Amazon was that psychedelics have a profound ability to affect people and really help heal them. But the biggest factor that I saw that actually helps people heal is human connection and the ability to have people who can relate to and talk to about their experiences. So when I got to New York, I kind of honed in on that. And initially, this started as a small-scale conference on psychedelic medicine in the same building where our library is now at. So we worked throughout the year, launched the conference last year in September, and then it went really well and just sort of naturally led to the opening of this community center in the same building.
And can you tell us a little bit more about the library?
Yeah, so we just launched in February. We crowdfunded to open the space to buy a bunch of books and build out the center. We're open Monday through Friday, 12 to 7. We provide sort of a reading room, co-working space in the daytime, and then at nights we do events and on the weekends too, related to psychedelics.
Now, I want to talk a little bit more about these events. I understand the organization holds space for conversation, celebration, connection, and more. Can you just expand on that a little bit more? And, what can people expect, if they are interested in joining this? Like, what are these conversations about? Or, how is this connection formed?
Yeah, I mean, psychedelics touch on so many different aspects of life. So we don't limit our events to any one direction. I mean, we've had comedy shows, we've had lectures, panels, we do a lot of author talks. Some events are just purely social. It's a way for people who are just looking to make friends to meet up and talk about these things. We've done events about AI, events about the medicalization. We have a lot of cool stuff coming up too. So it's all over the place.
And then what would you say the core mission of your organization is? On one hand, is it about, a way I understand that it was important to you to talk to people how they can safely learn about psychedelics? Or is it, a human connection and connecting to other people? As you mentioned, that was like part of the reason why you actually kind of wanted to start this in the first place. So what would you say the core mission is?
Yeah, the core mission is both. I mean, I think having a place to connect to people and to learn from other people is critical to education and to harm reduction regarding these things. So that's essentially the mission, providing a space for people to consistently find other people to relate to and to learn about these things.
And I also want to bring up the fact that, like when we spoke, online, you did mention that you wanted people to, like, education was an important part. And I think that whenever we're talking about anything regarding substances, like education is very important because these are things that people may have an interest in and they may go to different areas that may not always be the safest to explore that. Can you just explain, why that was important to you to kind of focus on education?
Yeah, because education is a huge part of harm reduction. I mean, if people don't know how to safely use these things, and inevitably people are going to use psychedelics, so we should provide resources for them to know the best approach, how to stay safe, and how to get the most out of them.
And often there is a stigma associated with psychedelics. And I understand your organization believes that there's potential for, a change in that. And I think that we've also seen this with, like CBD, now it's completely normalized, but I know for a very long time, there was a stigma associated with that as well. Can you just tell me more about your organization's effort to kind of, I guess, move away from that stigma or destigmatize this?
Yeah, I mean, the strange thing about psychedelics is that they've become stigmatized relatively recently in human history. I mean, these things, they're not new, they're ancient. They've been around for thousands of years oftentimes and used traditionally. So we like to help destigmatize them, but it's not like bringing about new information. It's like rediscovering lost knowledge from our society and from human culture. So.
And what are some of the efforts that your organization takes to destigmatize that? Would you say like possibly some of the conversation, or do you get people that walk in that are just kind of random and just want to learn more?
Yeah, I mean, I feel like that's the biggest piece for us because we're brick and mortar. We're in Midtown of all places, right between the UN and Grand Central Station. We get people walking in off the street who have no idea about psychedelics or they've just peripherally heard about them. So we're able to have really good conversations with people who are just, have no information about this. And so I think that's a big way we're trying to destigmatize these things, is acting as a bridge between the mainstream society and the psychedelic community.
And why do you think there is such a negative just view on psychedelics? I have some of my own ideas, but I want to know like what you think, why there is this stigma and why we view it in mainstream society in a certain way.
Yeah, I think a lot of that stems from the 1960s and how psychedelics were associated with the anti-war movement and the start of the drug war with Richard Nixon. I think we're kind of starting to gravitate away from that as we realize the benefits of these things, especially as treatment for certain forms of mental illness that are not, like treatment-resistant depression and things like that. So.
And earlier I mentioned like how as I was learning more about you, I felt like, I feel like this would be like a movie. Do you think that like media or like, our movies and television may have also contributed to people maybe having this certain idea of like, people who use psychedelics and like what they're about? Do you think that could have possibly had an influence and is that a negative influence?
Yeah, I think it used to be largely negative. There was a lot of like scare tactics and propaganda back in the 60s and 70s to dissuade people away from these things. Recently, there's been a lot of really positive like coverage in, TV and media. I mean, Michael Pollan just came out with a book, How to Change Your Mind. They did a whole series about it on Netflix. So I think as media shifts too, that's going to help the public perception of these things. Yeah.
Now, how could this aid in one's healing process, which I understand is very important as well to your mission and how you connect with others? So how does it help with the healing process?
Yeah, I mean, there's been a ton of research in the last 5-10 years showing that psychedelics have a much better effect on treating, in certain instances, a much stronger effect on treating treatment-resistant depression, anxiety, PTSD, all sorts of mental illness, but also a lot of physical illness too. I mean, they're still doing research and still figuring this out, but it can have an amazing healing effect on people who aren't able to help themselves with antidepressants or traditional means. Yeah.
Now, I also want to talk about, which I know whenever we talk about like any substances, whether that be drugs or alcohol, people bring up age requirements or, how young people are also interested in this.
Mm-hmm.
Do you think there should be possibly like the more it becomes mainstream, there should be any age limits or any age requirements to experiment with this?
Yeah, I mean, I began experimenting when I was 18. I feel like, young adulthood is probably a good point to wait. I would definitely not encourage children or teenagers to take these things, although they do in certain traditional societies in the Amazon rainforest. So it's like,
Okay. And that actually kind of leads to my next question. I understand that experience of, I don't know if that would say was the introduction, but it showed me that like acknowledging other communities and different cultures was important to you. And you made that a point to like recognize other communities and cultures. Can you talk a little bit more about that experience and why it was important?
Yeah, I mean, it's really critical to me to bring in as many different perspectives into the library space as possible, because there's so many different aspects of this community, and it's a big cliche in the psychedelic space that like we're all one, that we're all connected, but it's true. And bringing a room full of people together who all believe in that from all different walks of life to connect, it has some really cool effects. So.
That's cool. And I like that I feel like sometimes people can be ignored, or maybe they don't feel like it's a safe space if like they feel like, nobody looks like me here. So I think that's very interesting that, there was an effort to make sure that other communities felt included. Now, I think what's most important is, how will somebody know if this path is right for them on their healing journey? As I could imagine, it's, everybody heals differently. How could someone know that this would be something that's right for them?
Yeah, I mean, just trust your gut instinct. I mean, if you've exhausted other resources and nothing's been working for you, I mean, maybe start doing research. Libraries are good places to start, but learn about these things, listen to other people who've had similar experiences, and see if it sounds like something that might benefit you in the long run. Yeah.
Well, Kat, I want to thank you so much for joining us and having this conversation. This was definitely, I think, the first time that I've had a conversation like this, and it was really interesting. So I appreciate you taking the time to talk to us.
Yeah, thank you for having me.
If you or someone you know would like to learn more about this new social club, please go to their website at www.thepsychedelicassembly.com. We have to take a quick break, but we'll be back with more Open right after this.
I'm an ex-drug dealer, and I'll be your sub today. Can you see anything different as a pill?
No.
You don't know?
Fentanyl is being mixed into everything now. There's only one thing that will save somebody's life. That is naloxone nasal spray.
Fentanyl, it's cheap, it's potent, and it's profitable.
Why would drug dealers put a lethal dose of fentanyl in drugs if they know it's so harmful?
Really just all about the money.
I just didn't realize that one pill could change your whole life.
More kids should know.
One of the deadliest mass shootings in U.S. history at Post nightclub in Orlando.
Walking into the building for the first time after the shooting,
It was crippling, but it had to be preserved. If you're an ally of this community, speak out. There are more of us together than apart. It is the power of love in its rawest form.
Welcome back. As emotional intelligence becomes more prominent in New York City schools, educators may need to adapt or update their curriculum. Understanding the benefits of social emotional learning, the Senior Director of SEL for the Urban Assembly, Dr. Brandon Frame, plans to make this a nationwide effort, leading the largest SEL program in the country. Dr. Frame joins me now to discuss social emotional learning and the long-term impact it could have on students. Doctor, thank you so much for joining me.
Thank you so much for having me.
Now, can you tell me a little bit more about the Urban Assembly and the work your organization does?
Yeah, the Urban Assembly mission is to advance students' social and economic mobility by improving public education. I have the opportunity to lead the social emotional learning department, where we want to advance students' economic and social mobility by infusing social emotional learning into schools and ensuring schools are successfully doing that around implementation.
Now, I'm curious to learn a little bit more about social emotional learning. Is this something new? And then can you just explain what it actually is?
It is not something that's new. Social emotional learning is the process through which children and adults develop the skills, attitudes, and values to manage life tasks such as cognitive learning, forming relationships, and the flexibility to adapt to challenges and expectations of a complex society. Ultimately, these are skills that we use in order to be successful in everything that we do, from work to school in the community.
Okay, so you said it's not new. So I'm curious to know maybe what inspired this kind of charge for more schools and educators in New York to kind of, and across the country, to kind of, be a little bit more interested in this type of learning.
Social emotional learning definitely been around for a very long time. I think that the pandemic has created or caused schools to prioritize the social emotional development, but it's important to name that this is something that has needed to happen for a very long time. We both can probably relate to learning the Pythagorean theorem. We can relate to learning about mitochondria and photosynthesis. I mean, those are very important things that we do need to know. We need to read and be able to write. But we're sitting here right now because of our social emotional skills that we've used to navigate the world. And so I think people are starting to see like, well, we really need to develop these skills, because again, even with employers, what are employers looking for? Unless you're teaching math or teaching science, you might not use some of that information, but you are going to use your social emotional skills in order to get to that job, to do well in that job, and to move forward.
Now, as you mentioned, which kind of brought me back a little bit, like the Pythagorean theorem and, the powerhouse of the cell, all that stuff, we could kind of think back and remember what that looked like and while we was learning that in school. What does SEL look like in school? And is this something that kids are aware that they're possibly learning?
I love that you asked that question, even the way that you phrased it. And so one, it can look a lot of different ways. One is creating time in the school building to have a particular period that is directly and intentionally teaching social emotional learning skills. It also is sitting with teachers to work on how are you using your pedagogy to activate and teach social emotional skills while you're teaching math and science. And to your point that you just said in your question is like, we have to make sure that's explicit and intentional. When we teach math, it's explicit and intentional. When we teach reading and so on, we need to teach social emotional learning skills. One thing I like to say sometimes is that when students are struggling with math, what do? We ensure that they get interventions to learn math. When students are struggling with reading, we make sure they get the interventions to learn reading. When students are not as strong with their social emotional skills, oftentimes they get punished. Right. And that could be different ways in terms of how we treat it around grades and even behavior and different policies. Right. So it's important that what does it look like, though, when all students are developing their academic skills alongside their social emotional skills in an explicit and intentional way?
Now, I'm really glad that you brought up like the idea of like sometimes punishment being something used when a child or a kid or a teenager isn't maybe behaving in a way that is, I guess, beneficial to the environment. I kind of wanted to bring up, how this could benefit children in schools in low income communities where we see oftentimes they are punished. If maybe something going on at home and they bring it to school, instead of maybe tapping into SEL, they are faced with like detention or in-house, suspension. How could this benefit children from low income areas or children from troubled backgrounds?
Yeah, I think one thing what I love about social emotional learning, and when we center it as skills, is to even name that it is for all students to develop these skills, because this is what we use to be in community with each other. And even thinking about in different particular areas, these are the skills that you use to navigate the trauma, to navigate the frustration, anxiety of what happens in your community. And by developing these skills, we're able to move through these challenges that we face. Even when we run into mental health challenges are almost inevitable, but how do we navigate them? Social emotional skills. Learning, the process of learning is frustrating. We can all think about something in the last 6 months. We tried to learn, do something new, and it was frustrating. Going back to being in school, there was that subject that everybody had. It's like, that's that challenging subject. And how will we navigate that frustration, that anxiety? You use your social emotional skills. And so it is beneficial for every single student, even as we get into conversations around equity. When we get talking about ending racism and going into those topics, and how do we talk about sexism, you have to use your social emotional skills in order to have those conversations to then get to the end state of changing policies and improving our communities.
Well, that kind of leads into my next question. How does the Urban Assembly use SEL to build empathy and reduce bullying and disciplinary issues?
Yeah, so we've created the Resilient Scholars Program, and the Resilient Scholars Program is a guided implementation model to help schools and districts and communities be able to implement social emotional learning with fidelity. So it's an opportunity to look at the activities, the interventions and supports, and align them to social emotional learning competencies and indicators. So now we're looking at all the things that we kind of sometimes take for granted, the things that we just do, and say, what social emotional skills are these things teaching, right? Because going back to what we were talking about, which is explicit and intentional, so often throughout our lives, our social emotional development has happened implicitly, like life experiences, things happen, we develop self-awareness, we develop empathy, as opposed to what would it look like if we are explicitly and intentionally taught that from kindergarten all the way through 12th grade. And what does that look like once we walk across that stage and move into the complex society that we live in?
And this kind of just came to me just now, but how does social media, because I know when you're teaching children, social media and the internet plays just a huge part. How does that affect some of the work that you do, and possibly what they're learning online, which is a part of their development? Does that conflict with what their, SEL and what they could be learning at school?
I think social media gives us the opportunity to even elevate why teaching social emotional skills is important, because as we teach strong social emotional skills, especially around communication, that helps impact the discourse that people would have even as they're talking to each other on social media, as well as the content that they're consuming, and being able to delineate between what's right, what's wrong, what should I actually be consuming versus what I don't. Because the big thing about social media is that you get to choose who you follow, right? So if we develop really strong self-awareness skills, you can start to say, well, I probably shouldn't follow this, or maybe this is information that I probably shouldn't consume, because it does make me feel some type of way.
Now, how can this impact, or what can educators learn from this form of teaching? Because we talked about how it affects kids, but how does it affect adults?
So absolutely. So one, almost all adults in the current state did not go to schools where they were explicitly, intentionally taught social emotional learning skills. So one, in order for us to model it, we as adults have to take time to develop our social emotional skills so that we can model it for our students. That's so super important around this work. And then from there it becomes, well, what does it look like to take that and put that into my pedagogy as I teach students, so that now not only am I modeling it, but I'm helping students develop social emotional skills that I know not only will create an amazing school community, but when they walk across the stage, when they leave the school building, they are going to be able to flourish in the community and allow for the community to be strong.
Now that goes into my next question. How will this actually benefit kids and their social development beyond schools? So when we're talking about when they're young adults, when they're older adults, how will this benefit them in the long term?
So Thinking about the definition when you asked me what is social emotional learning, and I was like, it's about these skills to navigate a complex society. The truth is we live in an extremely complex society with different viewpoints and ways people think life should be, and how will we even have conversations and how will we create the communities that we want to live in is developing these social emotional learning skills. I thought about as I was walking in the school right here, the Walton campus, and there's a school there, International School for Liberal Arts, and one of the schools that we work with, and they do this phenomenal job in terms of developing their young people with their social emotional learning skills. And I've seen our young people go off into college and then go off into the real world and be able to navigate, be able to get the jobs that they want, to be able to flourish in those jobs, and also start families and have amazing families because of the strong social emotional skills that they develop while being in our schools.
Well, it's also so clear that you're very passionate about this. And I want to know, what inspired you to advocate for this type of learning? And, what are some ways that you've actually seen it, see the benefits of it?
Yeah, so as I've navigated my own educational career, I saw that social emotional learning was the key to success. I started looking at different data points. So for example, when somebody's ever gotten fired, why are they usually fired? It's usually a social emotional skill. When you look at why people get divorced, it's usually social emotional skill. And even being as a male, as a Black male, thinking about what does it look like for me to develop the empathy, to develop the compassion, and to develop the skills that would allow for me to be the leader that I want to be in the world. Social emotional skills was the key piece, right? I did well in school. I can read, I can write, but what was going to push me over the top and what is going to allow for other people to reach their potential? And it's the social emotional skills. So that's what drove me to be that passion and then want to travel around the country and work for the urban assembly. So to create the same conditions in other communities.
Well, I also want to add, you brought up something that's so important, and you talked about being male. And, I can imagine emotion, anything with emotions, and when you mix that with male, sometimes it could be complicated for a lot of young men to navigate. Can you just explain the importance of that, and especially when you're dealing with maybe boys in middle school or even high school, how you help them navigate that?
Absolutely. It's of the utmost importance that we prioritize the social emotional development for our young men. I mean, there's so many different data points that I could use to be like, hey, this is why. But I know so many men grow up, so many boys growing up to men. But when we were boys, we said boys don't cry. Boys don't show emotions, and how that actually plays a role in our lack of development to be able to communicate effectively with each other and with women. And so when we prioritize the social emotional development of boys, it allows for us to actually flourish and be the men that the community needs, that society needs, and be the men that we need to be for ourselves. And so that's a really major point of why I wanted to get into social emotional learning, is because I know how important it is for men and how different the world would be when we think about the social emotional skills, and we talk about empathy, we talk about compassion, we talk about vulnerability and what it means to be a comprehensive man, and don't allow your masculinity to just sit in one aspect of masculinity, but it becomes a full range because you tap into the other aspects of masculinity, because masculinity does include vulnerability, empathy, and compassion. When you have that together, that means that, wow, you're an amazing man that can lead his family, that can lead the community, and be an active member of society.
Well, Dr. Owen, thank you so much for joining us and have this really interesting conversation. We got to touch on some points that I didn't even think of prior. So I appreciate you so much for taking the time to talk to us.
You're welcome.
If you work for or a parent of a student in a school and you want to learn more about SEL, please go to their website at www.urbanassembly.org. We've come to the end of our show today. I'd like to thank all of our guests for joining us and you, the viewers, for tuning in. If you missed any part of today's show, you can catch the recable cast at 5 and 10 p.m. on Optimum Channel 67 and Verizon Fios Channel 33, or watch anytime on the web at bronxnet.org. You can catch a brand new episode of Open with Darren Jaime on Wednesday and Rena Valentine on Friday. I'm Kibin, wishing you and yours safety and wellness now and always. See you next time.